A quick note before today's episode. While I'm a professor of nursing at the University of Minnesota, this podcast, Midlife Unmasked, is a personal project and separate from my professional responsibilities at the university. This podcast is intended for informational and educational purposes only and should not be considered professional medical advice. Please consult your own healthcare provider before making any decisions related to your health and wellness. In keeping with my role as a nurse researcher and educator, I'm here to bring evidence-based information to improve overall health and well-being. It is my goal to be a trusted source of information and to build this community where we can all learn, grow, and share together. With that said, let's jump into today's conversation. Hey, Midlifers, welcome to the Midlife Unmasked podcast. I'm your host, Robin Austin, a nurse researcher and educator, and your guide to navigating everything from healthy aging and wellness to big stuff like caring for aging parents, mastering work-life balance, and discovering your next great adventure. So are you ready? Let's do this. Hi, everyone. Welcome to today's episode. I am thrilled to be here with Harpreet Gujral. I am just thank you again so much for your time and energy today. I'll do a quick introduction and then we'll just jump right into our conversation today. So again, everybody, welcome to Midlife Unmasked podcast. I'm your host, Robin Austin, and I'm here with Dr. Harpreet Gujral, who is a nurse practitioner and integrative health expert, and also a wellness coach with a passion for supporting women through their transformative midlife journey. With a doctorate in integrative health and healing and a board certification as a family nurse practitioner, Harpreet brings a unique blend of clinical expertise and holistic care to her work. At MIDI Health, she empowers women of all ages to overtake and take charge of their health, addressing hormonal imbalances, menopause, thyroid issues, and more through a whole person, patient-centered approach. Her previous roles at Nava Health and also the Kaplan Center for Integrative Medicine deepen her knowledge in women's health and chronic disease, while her training in mindfulness and integrative nurse coaching fuels her compassion for personalized approaches. Harpreet's mission is simple but powerful: to inspire healthier lives by listening deeply, honing each woman's story, and combining evidence-based care and integrative wellness strategies. So again, welcome, Dr. Gujral. I am so honored that you are here. Welcome to this podcast. It's all about honoring life, women, and this journey that we are on. And also I want to talk about how you got to where you are within your background. I know a lot about your background, but I just want to share with our audience as well, if you don't mind sharing.
Absolutely. And Robin, it is an honor. Someone of your caliber, beautiful human being you are, and brilliant nurse leader and amazing faculty. You're just wonderful. So it's an honor to be in your presence. Thank you. I'm very grateful. We both were talking earlier. This topic is really near and dear to both our hearts because we do see I'm entering in this age where I'm menopausal, and I got into this because I, as a nurse practitioner in healthcare for last 30 years, as a nurse practitioner for over 26 years, did not know to access help during my perimenopause. So I went through it silently. I went through it confused and did not have much clarity. And, my style is to just plow through things, challenges, be resilient, have the grit, and just keep going. This is how I've lived my life. And now in menopause, looking back and understanding the North American Menopausal Society, NAMS guidelines, and also sitting in and listening to women, understanding their symptoms, it really saddens me, the state of current health, where we are not providing our women, service and not providing them the real answers. So that's how I really got into it. I was like, I am not going to let my younger sisters suffer through, or my friends go through, without help. So that actually gets into my clients and my patients. I'm very passionate about this topic.
Yeah, I echo your passion as well. It was similar to me. I was entering this phase and I was like, what is happening? And nobody was talking about it. Not even my close friends that are either nurses or physicians or in the healthcare field. And I started doing more research on my own as well. And I was like, what? There's nothing out here. There's a very little research, very little. But then I found the Menopause Society, as you mentioned, which is a great organization. And it wasn't until a couple of friends of mine just kind of said offhandedly, what are you doing about this? And I was like, oh, there are other people talking about it. This is amazing. So it's been a transformative shift for me as well, I think, just personally, and then realizing very little information is out there for general public. And I agree that we have to do something because this is, one, it's a huge gap in our research, but then two, we do need help. I echo exactly, I'll just power through it. I can do this, but then it's, that doesn't help anybody. So
it doesn't.
Yeah.
And, I just have to say, Robin, so Sadly, I did not know my family, for because of my mood swings were suffering. Like they were nervous about it. I was very composed at work. I gave my 110%. But when I came home, I was spent and from insomnia and like waking up at 3 in the morning every night and not getting, sleep and having mood swings was really challenging. And I had no idea that my family was suffering. So I apologize to all of them.
Yeah, I agree. I felt like I had chronic PMS. Like it was like, what is happening? Like I really felt like I was kind of happy go lucky, but like you were a little type A and we're hardworking and you can only hold it together for so long. So I agree. I concur exactly. So I was going to dive into a couple of questions that I have for us just to kind of give our audience a little bit more insight and flavor into this specific topic. So in your work as well, working with women of all ages, and you've supported many women through this midlife journey, but what do you think is one of the most misunderstood things about menopause and then through this specific life stage?
Yeah. And if I may backtrack just a little bit
Yeah,
so we can use those terminology, I'll
sure.
just define. So perimenopause is the time we hit menopause. Menopause is 12 months off when we have no period as a woman, which is not explained by, we don't have an IUD placed or an ablation. It's just naturally stopped having period 12 months. Then we're in menopause. And prior to that, we are in perimenopause when we're having these changes. And I can, we'll talk about those some symptoms as well. And the myths around this is like, this is normal part of aging, that you're forgetting things, that you can't have focus, that you're, feel like the skin is changing, getting drier and, the libido is changing. It's all part of, just getting older and you have to just, live with it. Or everybody else is fine. Like on social media, everybody looks put together. And it's just me who's having these issues. And so I guess if I can just try harder, be at the gym, work out a little bit more and watch my diet, maybe that can help. I mean, it helps, but that's not the only answer or all of the answer. And we know that hormone changes, like if people feel like hot flashes or, if they were having like just one or the two symptoms, they think it's not too much. Like I don't need to really address this with my provider, but not knowing that, I'm keeping my heat cranked up, cranked down, AC cranked up, in the middle of winter. And there is something about that, like, or, women might say like, I don't want my partner touching me. It's like, I don't. So not knowing that, hey, that's change in libido or, there is something happening with my temperature regulation. So, or thinking that I can't do anything really about this. Like I just have to plow through this, which was my style.
Yep. I love that you talked so much about the symptoms as well, because I think if it's people can brush it off that it's, hey, oh, it's one or two, whatever, it's hot flashes, or maybe I can't sleep, but that's just normal. But I think the other downstream effect of this that I didn't really realize either, which is part of wanting to talk more about this, is that how it affects all these other health systems in our bodies. So, for example, the decreasing of estrogen really can affect our muscles and our joints. So it's just not just muscle pain. There's a reason behind it. And it's not just getting older, or cardiovascular symptoms if you have heart palpitations. So I think that's the other piece, is that it's not just a few symptoms, but it can have a cascade of other effects down the road. So, and really impact healthy aging. So that's a really good point that you made up as well. I think that's something that we overlook a lot.
Yes. And I do have women saying, I have night sweats and hot flashes, or they might say, I don't have that. Really, I don't have perimenopausal symptoms. But when we do, kind of go deeper, they might say, well, I have no motivation to work out anymore. I was someone who always worked out, always did running and so forth. And now I can't do that. My mood is really off. I sometimes have rage symptoms. They might say, I have no interest in being intimate and I have joint pains. Like I have frozen shoulder or joint pains. I just don't recover as quickly, or brain fog. I'm just remembering, like it's really hard to remember things, why I came into this room, or remembering names of people I work with, or, just events and things like that. I knew that was part of my work. It just came naturally to me. And now I have to like make lists or write things down. A lot of women will come and say that, like, I have to jot things down. I'm not applying for that promotion because I feel like I can barely do my work. I cannot apply for promotion. So a lot of women are actually getting left out in their professional advancement because they are thinking that this is like some sort of permanent affecting their brain fog, that they really cannot, thrive professionally. So,
yeah. And I think you brought up a key point too, which I don't necessarily have one of our questions, but I just wanted to bring it up. You mentioned a workplace, and that I think having resources for women as employers to getting the word out that you should be having resources at work. Cause like you said, it really can and that kind of midlife career invisibility almost, because potentially related to menopause. And there's a decrease of self-esteem and self-confidence for women at this point, in which seems odd because we've already had experience, life experience. We're mid-career potentially, and yet we're having a loss of confidence. That's just not okay. And so I think mentioning the workplace is a great component, and for people to be aware of it. And yet 1 in 5 women I read leave the workplace because of menopause. I didn't realize those staggering statistics.
Yeah, that's a loss, big loss to, workplace, big loss to society, where women are quietly just leaving workplace because of lack of, ability to keep up. It can be quite challenging. And they feel like they're the only ones going through this, not
Exactly
in their office. Yeah.
Yep, absolutely. 100%. That's such critical insight. And I think for women to listen to themselves and to go seek help with, if they have things that are just not quite sure what's happening, it's okay to go ask and say, is this normal? I did. So I just wanted to talk too about your background as a nurse and then also integrative therapies. Because I think some people are also through this time period, like, I don't want hormones. I don't want to go be on hormone therapy. What are some things within your background as well? And explaining you're a nurse practitioner, you're also a wellness coach. And how do you approach menopause care that might be different than traditional medical model potentially?
Yes. So, for me, Robin, I was born and raised in India. And so I was always someone who looked at science as my guiding framework. So I was always a skeptic when my mom talked about homeopathy and Reiki and healing energies or, aromatherapy, until I got into integrative nurse coaching. So this was with my teachers. It was a 6-month course. I actually was going to do this course because I thought my patients will be better served. And I had no idea that this was a time for self-revelation, introspection, reflection, and self-growth. The whole course was really about really understanding ourselves first before we go out to try to help some other patients or clients. And so I'm really grateful for having amazing mentors with Inca, nurse coaching, integrative nurse coaching, where Barbie Dossi and Susan Luck were just amazing teachers and taught me so much, and my fellow coaching students who synthesized their experience. And so as I got through that, I realized that, I was not bringing my Indian heritage. I was showing up just half of myself as, someone who's worked in healthcare for so many years in the United States. And as I grew from that, I got really interested in understanding how integrative approaches, holistic approaches kind of work. What is the scientific evidence behind it? What is the understanding, the intelligence around it? And so not until I was taking, with the professor at University of Minnesota and looking at all the evidence and looking at all the, scientific publications, I called my mom that day and I said, Mom, I'm so sorry. You've been teaching me Reiki and I didn't believe it. And she'd already taught me 2 levels, but I just didn't believe it until I, worked in the University of Minnesota, as the Reiki, studying level 1 and level 2, I realized that how energy works, how it really can make a difference in healing. So I had to put my, integrate all of me as who I am as a human being, both doing the integrative nurse coaching and getting the doctorate in nursing practice at the University of Minnesota, focusing on integrative health and healing, really allowed me to synthesize all pieces of myself together and then bring all the science and traditions together, and then utilize this information, the lived experience of myself, my challenges, and the experience of, the learned lessons from my patients over all the years, the thousands of patients, who I had the honor to serve. So bringing all of that together has really helped me to now, serve women in this age group, helping with perimenopause and menopause.
That's amazing. And I think it's really truly the blend of all of these and ourselves that we bring to the patients. And I think it's such a wonderful way to look at things from a medical model, but also a holistic integrative health. And now we know that there's a huge kind of initiative with the National Center for Integrative Therapies around whole person health. That's really the movement forward. And I think that's such a great way to be able to combine all of these pieces together. And that's what patients really want, from my experience as well.
Absolutely. So, even with functional medicine, like I did, several courses in functional medicine, we look at root cause versus suppression of symptoms. Like traditionally, as a nurse practitioner, I would write a prescription for people's symptoms to get better. And now it's like, okay, root cause, what's causing all this, and helping people see the intelligence of their own bodies, and that the whole person care versus like one size fits all, like this is the cookie cutter approach and everybody else is going to get the same treatment. So really moving from that to whole person care and very specific to, what is their belief system? What traditions do they believe in? What has helped them previously and what has not worked? Not just letting people wait it out, like actually working on their transformation, especially a lot of women, as you might know, Robin, are actually noticing like around this age when we come into perimenopause, menopause, we're looking at like this awakening on the inside, like it's like spiritual awakening. We may not be religious, but there is a spiritual awakening of our transformation. We start to notice we are creating our versions 2.0. So just understanding all of that. And obviously, being supportive of women and making sure that I'm guiding them through the, education, collaboration, it's shared decision making, and empowering them instead of the patriarchal medical system that we all, like my generation, obviously, like over 35 years, I've seen that, and now it's shifting, obviously, but all of that allows women to just be on this healing journey, and they can, start to notice not just symptom relief, but really creating that version 2.0.
Yeah, I 100% agree. I think it's true that I think we're like the Generation Xers that are no longer, we're not taking menopause just sitting down. Like it's in this midlife journey. And I think allowing and creating space for that to say it's okay to be version 2.0. That doesn't mean it was bad in the past. It's just that we're re-envisioning a new future. And I think that having room for that is quite amazing. And I think too, the other part is that in addition to all of the whole person health and that movement forward and allowing space for like a new kind of approach to healthcare around like we're no longer the sage on the stage. We're kind of like the guide in a way. We're facilitating that care. And so I'm hoping that evolves over time around whole person health and how we interact with our healthcare providers. Yeah, I hope that does shift.
Robin, it's really interesting when I'm sitting with women, and I speak with hundreds of women every month, right?
Yeah.
Hundreds of women. And it's such an honor and a privilege. Some of them are shocked when I ask them about intelligence of their body, or ask them what they think about this particular plan, or invite them into creating this plan. And it's really, for some women, it's very awkward because they have been told what to do. And why am I asking? Like sometimes it's like, oh, that's your job. And it's like, this is collectively shared decision making. We're doing this collaboratively. Because you're the expert of your body, and I'm bringing in the science and the experience of other women and my own personal experience, but it has to be done collaboratively.
I think, and I agree. I think for so long, women have been given the message that like, you're separate over here, like you're to not tap into your own sense of self. And so it's hard. It is awkward to be like, what do you think? What do you mean what I think? Like, I don't know. And so some of my work is focused on identifying strengths or resilience in women. And for a long time, they're like, what do you mean? What do I think is going well? And so it's, it's like, what do you think is going well in your life? And we all bring strengths to the table. What do you think that yours are? Well, I don't know. No one's ever asked me before. And so I agree. It can be a little bit of it jarring if I think being asked to kind of go within, because for so long we are so focused on external things that we don't give ourselves enough space and time to really go back in and say, was this really truly what I want? I don't know. So I love that it's an awakening. It absolutely is.
Yeah. So I'm planting seeds right now. So
Yep, absolutely. Yes, I love it. So the other question we had talked about too, signs and symptoms of menopause, perimenopause, things like that. But I just wanted to touch on a little bit of the questions I typically get are around lifestyle factors. So what role do lifestyle factors such as nutrition, movement, stress, all play in managing those perimenopause symptoms? And how do you help women personalize their approach?
Yeah, no, that's beautiful. And so this is where, we're just talking about like letting women lead their own lives with these beautiful pillars, the 4 pillars, of nutrition, sleep, movement and stress reduction. And obviously 5th is, connection. So, what is my place in society and how connected I am to others? And we know nutrition, it's not just putting some food in our body. I've asked women, I was like, would your mother let you have cheese crackers for lunch? Like, it just saddens me because a lot of time, will we do this to our children? And yet a lot of us are juggling so much through our professional lives, working from home. And if we haven't had a chance to prepare, do meal preps, we might end up just getting cheese crackers, like, which is so sad, So we know that nutrition is actually fueling hormonal balance. It is chemical information. It is allowing our good genes to be turned on, bad genes to be turned off. And that's a whole topic in itself. And I would love to share that sometime. In fact, I just did that for another group, and it's fascinating what nutrition can do for people, stabilizing the blood sugar, really helping with liver detoxification, which is necessary for hormones, promoting gut health, reducing inflammation, building blocks for hormone production. So all of that is through nutrition. So I ask my clients to actually look through food as, is my food are my food choices giving me all of those things? Like this could be simple as I say, your fast food is running to the grocery store and picking an avocado. And, if you do dairy, would you pick up a yogurt? Or, if you're in a rush, and would you grab an apple or celery and hummus? If that was your fast food, it's cheaper than, stopping over at a drive-through and then regretting the fact that, why did I put that kind of food in my body? So nutrition is huge. Obviously, we studied functional nutrition. And so I like to bring that, weave it into, our lifestyle. And stress reduction, we know that hypothalamus pituitary adrenal axis. So I show this with all my patients, all my clients. They learn about HPA axis and how it's HPAO axis. So there is ovarian axis. All of this is talking with ovaries, and our hormones are, guided by what thyroid is doing, what stress is happening, how much cortisol is being made. And the midsection weight gain, we start to notice that happens, which is very stubborn. And so women are really trying to, they're just frustrated by that. So how do we make sure that cortisol is not disrupting the estrogen, progesterone, and causing the sleep, cycle to be affected by that, causing insomnia? And how do we make sure the anxiety, which is the new sense of anxiety, like this lack of groundedness, that just women come in and describe like this, they feel like this new anxiety, which is not theirs, they're sensing that. So we know by managing the stress, by working on the HPA axis, we can actually help support them, have a discussion with them to see, their faith, their usual practices, what do they do? What mind body practices would they like to be in nature, move the body. As we know, movement is so important, especially during perimenopause. We're starting to lose muscle mass. We're starting to have, issues with bone health. So how do we make sure that we are maintaining, if not gaining more muscle mass? I started doing strength training post-menopause. I was already menopause, and I was like, I'm going to work with a trainer. And I actually gained 5 pounds, 4 to 5 pounds of muscle over the last 3 years. It was a lot of work and something that I not necessarily always enjoyed while I was doing it, but it was really necessary for me to engage in that. So we know that movement is absolutely important. And I say this to my patients and clients that if I were to write 2 prescriptions, one will be for movement and a second one will be for sleep. Like it's so important to make sure that we're protecting our sleep as well. So movement, as we know, will help with, muscle mass. It will help with blood sugar, cognition, absolutely, and also improve immunity and bone strength. But sleep is like the best anti-inflammatory agent. So if we can just protect our sleep, make sure that we're not doing one more thing at night, or, this rebellion among some of us, like, hey, this is my time, so I'm going to stay awake, or, so really looking at that and making sure that we're going to bed at a decent time and looking at our circadian rhythms. So a lot of work has been done around that. And what is my circadian rhythm? What's my clock say? Who am I naturally? Obviously, most of us, we know, whether we look at Ayurvedic, clock or traditional Chinese medicine, 10 p.m. is the time when the intestines and liver need to detoxify, and they would like us to be in bed sleeping to have that happen. So really, sleep hygiene is huge, especially around devices and, all the social media and our time for ourselves. And that will help with the nerve system regulation. It will help with inflammation reduction.
I agree. The movement is medicine. And I think I've always thought that the most prescribed pill would probably be exercise if it were actually a pill.
Absolutely.
If you're crabby, go for a walk. I'm one that has to exercise more, not necessarily for vanity reasons, but for my mental health. Like I have to. Otherwise, I'm just not a nice person. And come the afternoon, I would agree. And sleep it's harder to switch that mental shift to make sure we are sleeping and to say it's okay to prioritize that you have to go to bed and that you have to set this time aside, because it does really impact overall things. And we're starting to, like you had mentioned, learn things downstream, how health, brain health, all these components start with kind of in midlife and setting these really good habits for ourselves now. So that's fantastic advice. I love that. And I like could you mention the 5 pillars again that you talked about?
Absolutely. So definitely nutrition. There is a beautiful, obviously they visit University of Minnesota's, Center for Spirituality. It's beautiful pillars as well that are defined. But these are things that I'm using, whether I'm doing a quick visit at my current workplace or I'm with my client for coaching, I'm spending time on really building on these pillars. And some are mastered, some have mastered the sleep, but movement is an issue or nutrition is an issue where others are, no problem. In my previous years, when I was working in weight loss, whether it was medical or surgical weight loss, I was very interested in ghrelin and leptin and, hunger hormones. So we know when people don't sleep well, they will have issues with increased hunger the next day. They may not be able to make good choices the next day. So usually my clients who are like, oh, I have this weight gain, it's stubborn, it won't go away. What do I need to do? That is really important is I, start with like, we must sleep. It doesn't start with some dieting and, having to create calorie deficit. It's really about let's make sure we are sleeping well. And, it surprises people, but it's so important to make sure that they are, practicing good sleep hygiene.
I would agree completely. And I think that's been the hard one for me to kind of overcome. It's like, I just didn't have another cup of coffee. I should really just be focusing that I can sleep tonight. And so, yes, that's wonderful. And I think the other component too, you had briefly touched on is making sure that we're being consistent with all of these components. It's just not just a one-shot day. It's consistency throughout. And how do we integrate this in a way that works for ourselves through this time period so it's sustainable as well?
Yes, but I have to say, us women, especially professionals, I think we chose our professions because a lot of us are type A's. So we're looking at perfection and we're looking at like self-judgment or lack of compassion. And we're like, where's my stick so I can, like blame myself for not being perfect today. So it's really giving ourselves grace is what I say, like reset and give ourselves grace when I am not, when I haven't been able to do this, well today. Then I say, okay, Harpreet, tomorrow's a new day. We're going to reset. And what else do you need? So I have done Kristen Neff's course on self-compassion, and that really helped my personality type, where now I can put a hand on my heart and go, okay, what do you need? Like, you're trying your best, like really good job, so it's like that encouragement and being our best friend and being kind to ourselves and really encouraging, to build these habits, as you were saying, Robin, at the same time being also, grace and compassionate for ourselves, knowing that we're not perfect and life happens. It's messy and magnificent at the same time. So we got to be kind to ourselves.
I would agree with that. And I think that kind of is one of the pillars of connecting. It's making sure we're connecting with ourselves in a way that's positive. And I think women, we're so hard on ourselves. Like someone was asking, I was listening to a different podcast and they were talking about an exercise to say, like, what do you say in your head? And they were having someone write it down. And like, would you actually say that to another person? No. Like, that's just terrible. And I think how we talk to ourselves is part of the issue. Like, it's such an ingrained way of being, unfortunately. And so I think that self-compassion that you had mentioned and having the connection with ourselves in order as part of one of those pillars, I think is so, so valuable. And I think it's one that's often overlooked or just not comfortable to talk about potentially because it may seem too touchy-feely, but I think it's a huge component to our overall health and well-being. Absolutely.
Yes. And then the connection, so it's connection with self and connection with others. So do I have like, it's not about how many people on LinkedIn do I know or how many on my Facebook and my Insta account, but it's like, can I tap into 5 people who I can just pick up the phone and they'll take my call? Do I have those friendships and support system in place? So it's give and take, obviously. It's like being there for them. And, we have like a special group that I call the bus stand friends. So girlfriends, and we've known each other for the last 16 years. And so our kids have grown up and they no longer are in touch with each other, but we friends, 4 of us have been together. And then obviously, best friends from, other circles. So I just consider myself very blessed and I really nourish those connections, whether it's meeting for a walk in the morning on a Saturday at a park. So we each give ourselves that exercise, that connection. It can be done instead of like meeting at a cafe. I mean, we could still meet at a cafe, but since we want to exercise, we're like, let's meet for a walk.
Yeah.
So we can be in nature, which we know nature heals in so many
Yeah.
ways. So can we surround ourselves with biophilia, nature, and then be connected with others who care about us and
Yeah.
vice versa.
I think that connecting piece is so valuable and so important. Sometimes it's the last thing I want to do when I'm overwhelmed and I'm stressed out. I'm like, I don't have time, but it's probably the best thing that I need to do at that time as well. So I think it's something that we should hopefully add more value back into our lives I think in midlife too, there's been such a movement around social isolation in our society. And we've been fixated a lot on older adults, which yes, rightfully so. But I think it even back it up even more. I think it's this midlife journey where we're like, I still feel like it's this midlife invisibility sometimes. And so I think that's a piece to really be considering as well. That's so, so important and valuable.
Absolutely.
Yeah.
And Robin, when we're navigating all these symptoms, we're in sandwich generation, like a lot of us
Yes.
in sandwich. We're taking care of our parents, we're taking care of our children, we're taking care of our household, managing our profession and trying to grow and do our own self-growth and all of that. Sometimes we may forget. And then our friends are the ones who can point out and say, oh, you know what? You used to love that hobby of yours. Like what's going on there? And it's like, oh my God, I could totally drop that. Like that brought me so much joy. I could be doing this. So, so our friends know us and they can actually point us in a right direction or be kind and be there as a listening ear. But also us recognizing like, oh my goodness, like we're doing a lot as women in this generation, in this midlife, age group.
Yeah. And you brought up another point, which it would be another separate whole other podcast, is the sandwich generation. And I think that we don't necessarily give ourselves enough talk about that as well. And someone had brought it up at an event we were at with just other parents that we know, but it's either we're talking about our aging parents or we're talking about our kids. And so that's a whole nother episode potentially as well in the future. But I would agree. It's something that's very real. And I don't think it's given enough credit at sometimes. Yeah, absolutely. So a couple other questions I have. I know I want to be mindful of our time here as well. And so I guess one of the questions is about hormone therapy, I think. And so that can be super confusing. I think too, we've had some misinformation potentially in the media, or it's conflicting information. One day something's good, one day it's not very good. So you're like, what do you even believe? And so at the time I'm like, I don't know, I give up. And I kind of know where to possibly go to find information. But how do you guide women in making informed decisions that align with their values and also their health goals, maybe around using hormone therapy or not, potentially?
Yes. And so, it's really about sitting down with women and making sure that they are making an informed choice. They're making informed decisions. So providing them, the correct information. So they're really important because as you said, there is so much misinformation out there. The Women's Health Initiative, there were WHI study that was done. I mean, this came out in 2003. I became nurse practitioner in 1999. And we learned that, oh my God, like you should not be giving hormones to your patients and this and that. And all those myths, have been busted. We have better information, more data over the years. And, following the North American Menopause Society guidelines and looking at that. So sitting down with women and giving them that opportunity of understanding what is the data right now? What is your personal history? What is your belief system? What is your family history? What is your, if you need to drill down, if someone has had a history of breast cancer or specific family history, we drill down and figure out like what's going on there. But majority of women, it is quite safe for them to consider HRT for not just to mitigate the symptoms they're experiencing, just to get better in what they're feeling, but also to look at the long-term data in heart health, in bone health, joints, and so forth. So I have my mom and I have my mother-in-law, and they both have their own share of not being offered hormones and then having issues with osteoporosis and having had 2 fractures, and the other parent has had dementia. And so it's really sad to see like a couple of generations of women were just skipped and were not provided any information so they could have made their own decisions, unfortunately. So really my goal is to normalize the confusion, provide women, the scientific evidence, and then educate them without overwhelming them based on, what is their interest, how much do they want to learn and know. So really figuring that out and making it, something that's easy to understand then. And I have women who are engineers and they want to go into the deep data, and they're
Yeah.
totally fine. Professors and engineers totally can go into that. So really looking at individualized care, So I have women who will say, okay, thank you so much for all this information, all this data. I understand that you are using bioidentical hormones, in the work setting, but no, that's not for me. I don't want that. So they might choose to do something different. And then, so I provide them the science with what are the non-medications, what else can they be doing to manage those symptoms? What are their goals? They're just looking at relief? Are they looking for future prevention, how to weigh the risk versus benefits, the pros and cons, and going with that. But I always talk about lifestyle first because it's really important. It's so boring and non-glamorous, like what food, sleep, movement, like why did I have to come to you to talk about that? But the support they receive, the accountability they get from that support really allows women to feel like they're not alone, they're not doing this by themselves, they've got the support in place, which really makes a huge difference. So providing that collaborative approach, and then having them make decision. But then what's most important is like they should not feel guilty for not choosing it. It's really their preference, and what they decide, I support them in that decision making, as long as they have all the right information available to them.
Yeah. And I think too, it's so personalized. Like you've seen one person's menopause is one person's peri, you know what I mean? Like everybody is so different that you can't have a cookie cutter approach anymore. We just absolutely cannot. So I think it's so important to be able to listen to women, and you can change your mind. Like, I don't want to do this right now, but in 6 months you might want to, and that's okay as well. I think we're allowed to change our minds and change that course of trajectory for our own health, and having the autonomy to do that is amazing.
Yes, absolutely.
Yeah.
And I say this all the time. I'm like, this is not written in stone.
Yeah.
Please know that. Like in 6 months, 3 months, next month, you change your mind and you'd like to make a different decision, I'm here to support and provide you more information.
That's wonderful. I love to hear that as well. So I just have a couple final questions as we wrap up. One, you're a nurse by background. I know we had talked about this before we started recording, but could you just give us a little snapshot of if there are nurses out there listening or nurse practitioners that might be interested in health coaching, or nurse coaching as well, just to give them a little insight into maybe next steps of what they might want to do for adding this kind of component to their overall repertoire of their professional kind of resumes? What would be the next steps you would recommend?
In fact, I was just speaking with someone today. She started from being a housekeeper and has just earned her bachelor's degree. And we just talked about it, and she's so interested in taking, exploring the University of Minnesota IHH program, PNP program. So nurse coaching, there are amazing programs. There's INCA, which was my program. And then there's University of Minnesota, which, we know that there's a coaching program, a master's program. So look at your national programs that support you, with integrative approaches. And because there is within coaching, there are so many fundamental principles, of why and how we become a nurse coach. When we were recording, and this was in 2012, 2013, when I was doing the nurse coaching training, when we were recording back then, we had the cassette tapes. So I would put the cassette tape and I would listen to it. And in the whole coaching, my client was talking less and I was the one talking more. And I had to reverse that because in coaching, you're really listening in deeply. So a reminder for us nurses, like we're not wearing the expert hat when we're coaching. We're actually understanding the person in front of us and encouraging them by asking the right questions, not providing them the right answers necessarily. And with that, just the presence, the deep knowing, the listening, the support, it allows them to come up with the right answers. Obviously, we'll provide them the support they need. If there's more knowledge that needs to be provided, that's always asked with a permission. So as a coach, we always ask permission, like, do I have your permission to provide you some resources like this and this? And so, So I hope I answered the question.
You did. That's fair. I love that take too, because as nurses, sometimes we can plow in with the right answers and this is what you should do and XYZ and there you go. And it's a little bit of a different shift with health coaching. And that's a great idea and a great, I think, mental model for those that are interested in coaching to kind of take that consideration as well. So I like that a lot. That's awesome.
And it's deeply satisfying. Oh, it is so satisfying. Like that is my calling right now. So
yeah, I would agree completely. I love that. So my final question is that what is one piece of advice that you would give every woman entering her 40s or 50s or perimenopause to prepare for a vibrant and empowered midlife?
I would say to the woman, listen to your body. It is full of wisdom. In our rush life, it's just very easy to ignore the fatigue, the mood shifts, the low energy, the weight changes, the ignoring what we see in the mirror, all of that. Or it's just stress, whatever, I'm juggling. So really asking ourselves, what do I need more of and what do I need less of? Because we're doers, we're human doers. And so can we just look at just being and reflect, and maybe we need to do less. So I usually, in my clients, I would help them look at like, what can they take off their list instead of adding more things on? And then also understanding, what is my body trying to tell me? Like, if I can be friends with my body as opposed to thinking it's an enemy or it's a foe, it's not listening to me, it's gaining weight, it's looking, not desirable the way I want to. Instead, like really being friends with the body and just checking in and saying, what are you saying? What do you need? Physically, psychologically, spiritually, what do you need? So that's what I would say to fellow women, because I'm in pursuit of this right now. I'm practicing this right now.
Yeah, that's lovely. I love that. And thank you again. That's such great insight. And thank you so much for your time. I really appreciate your insight and everything midlife, but also your expertise as a nurse and a health coach and being involved in this field for so long. Your expertise is just so well deserved right now. So thank you again.
Oh, thank you, Robin. It's an honor and a pleasure again to be part of this podcast today. Thank you.
Thank you. That's a wrap on this episode of Midlife Unmasked. I hope you found inspiration and a few key takeaways. If today's episode resonated with you, please be sure to share it with someone else that could also benefit. And don't forget, this podcast is here for you. If you have a topic or a question you'd like us to explore, please send it our way. Your feedback helps us reach even more listeners on this shared journey. You can find us on social media and our website, midlife-unmasked.com. That's midlife-unmasked.com. And the links are also in our show notes. Until next time, keep unmasking your potential, embracing the possibilities, and living your best midlife with courage and confidence. Take care and see you next week.